Today we're going to look at the topic of sleep disturbance and temper tantrums in children aged 2 to 3. And in particular, a study by Miller et al. From 2009 that looked at babies who had colic and the effect potentially on their sleep and behaviour when they were 3. So there were two groups. There was one group that had chiropractic care on these so-called colicky infants, and another group that had not had any chiropractic care. And they went and looked at sleep and behaviour at aged 3. And particularly they had found that those who had the chiropractic care were less likely to have temper tantrums. So for example, the chances of having more than 3 temper tantrums per day was about 10% in the chiropractic group and 37% in the non-chiropractic group. The chances of having 1 to 2 temper tantrums per day was 30% in the chiropractic group and 36% in the non-chiropractic group. And the chances of rarely or never having a temper tantrum was 60% in the chiropractic group and 27% in the non-chiropractic group. In terms of sleep, the chances of falling asleep within 20 minutes in the chiropractic group was 78% versus 38% in the non-chiropractic group. And the chances of sleeping through the night was 68% in the chiropractic group compared to 33% in the non-chiropractic group. So the authors concluded that these children at age 2 to 3 were twice as likely to have sleep or behavioural disturbance if they had not had any chiropractic care as infants, in groups of babies who had colic, of course. So the take-home messages from this study, firstly, all studies need to be repeated and done again, and every study has its faults, so this is only one study. But what we do find in our practice as a children's chiropractor is that unsettled babies is a very, very common presentation, and also sleep problems and behavioural problems are also a very common presentation at age 3. But really interestingly is that we'll often find the same body dysfunctions on both groups. So children who are aged 3 will often come in with the same sort of body patterns and problems, exactly of the same nature as the infant who had so-called colic. Finally, another take-home is the word colic is just fraught with difficulties and really should be abandoned in some ways. The definitions are difficult to apply, and also it really implies for most parents that the cause of this unsettled baby is gut related or wind related, whereas in many babies this is just not the case. The word colic is a difficult one, and we prefer to use the terms unsettled baby syndrome. So finally, if you have a baby that's experiencing difficulty with sleep or is unsettled, or a 3-year-old who is having behavioural issues or sleep issues, feel free to come in and have a chat to us about that.